Let's do this.
Let's do this. Okay, so welcome everybody and thank you for viewing this video. I have got with me today François-René Bertin and we're talking about equine endocrinology. But this is slightly different for our viewers and our fans who love our Baby Scholars webinars because this is actually a PechaKucha. So a PechaKucha means chat and you give your speaker around 20 images and usually 20 seconds timing, but I've been a bit nicer to Francois today. I've given him 40 seconds because it is a really meaty subject and it's probably not enough to go through, so we're going to watch Francois go and talk really fast. So when I hit play, it's going to roll through. I'm hopefully not going to be touching anything in the background here to speed this up or slow it down. So Francois is going to have 40 seconds per slide. He's going to introduce himself because we've got this first slide here ready to go. And I will pass over to Francois now. So good luck. Are you ready?
Yes, I am ready. Thank you, Lizzie, for the introduction. So yeah, it's really my pleasure to be giving this PK. It's my first time to do this format, so hopefully everything goes well and it will be great. So yeah, a bit of my background. I mean, you can hear my accent. I did my DVM in France. So I moved from France to do my residency in large animal medicine at Purdue University. Then I moved to Canada for my PhD and then went to Australia at the University of Queensland for almost 10 years. And I've just been back in the US now to work even more on equine endocrinology. So this is really my field of research, my field of expertise, and oh, it goes fast. So this is the first picture I wanted to discuss. So this is a laminitic foot. So this is evidence of chronic laminitis. So you can see that you do not have the perfect alignment between the phalanges. So P1, P2, P3. You have some severe remodeling on the top of P2, of P3 as well. And you also have that evidence of acute laminitis. When you try to follow the lamella, you lose that completely. So this is a good evidence of a case with active and chronic laminitis. You have the hoof rings, you have all those changes. And I think it's really important for us to really start with the foot. Looking at this horse is an example of a cresty neck. So many people will tell you that this horse is muscular. No, it is not muscular. This is just fat. So it's really important to be able to grade those necks and really teach the owners how to grade those necks and really touch them. So this is a good example of a grade 3, which means that we have more filling in the middle. It's quite large for him, but we do not have any wrinkles yet. If we had wrinkles, it would be a grade 4. And if we had a homogeneous filling, it would be a grade 2. Here we have more filling in the middle and it's going to be quite hard. So this is a grade 3. For this slide, I wanted to talk about the pasture and the different types of pasture. And it's important for horses with equine metabolic syndrome to know what they graze. Here we have an example of way too much grass with some horses that really spend their time eating. We have to remember that horses were designed to eat pretty much all the time. And if you have a pasture that is very rich, it will be even more sugar for them because the enemy in this equine metabolic syndrome is how much sugar they're going to eat. So here we have an example of a pasture that was fertilized that will increase the intake of the horses, will increase the sugar, and that will increase the risk of having laminitis. This picture is a typical case of PPID. So although PPID and EMS are not the same disorders, we know that PPID is going to be associated with insulin dysregulation in up to 70% of the cases. So you have kind of a compounding effect of laminitis, of PPID and EMS to develop laminitis. So my recommendation for those would be if you have a case of PPID, please do test for insulin dysregulation. And if you have a case of EMS that is turning 12 to 15, I think it would be a good idea to investigate PPID. This is an example of some chronic changes that we have on the feet, and we have to train owners to recognize those. So it's not just because they want more or less grass at some point, it was a drier year or a wetter year. It's really those changes that will be associated with laminitis. So when you have those wrinkles on the hooves, So it would be good for owners to be able to do that. And something we can teach them, and I've been able to teach that to some owners as well, is the modified obel grade. It's going to be to differentiate some small changes in the gait of the horses. So you're going to look at the horse to see how they're shifting weight and see how they are going to proceed. This is an obese horse, and although obesity is not consistently associated with insulin dysregulation, it is something that we will consider as an exacerbating factor. So we need to teach owners how to recognize obesity. They are going to underestimate that quite often, usually by 1 grade, because they do not know where to look. So going to pay attention around the shoulders, around the tail of the head of the tail, and obviously around the neck. And once owners are able to know what to look for, they will be very good allies to know how to assess those cases. HEA analysis is fundamental to the management of equine metabolic syndrome. So we talk about non-structural carbohydrate, and unfortunately, it's not something that you have readily available. So to know the percentage of non-structural carbohydrate, you need to add the water-soluble carbohydrates and the starch. Ideally, we would be below 10 for horses with equine metabolic syndrome, and we want to make sure that we feed those horses enough. We've had many cases that are actually underfed. A horse is supposed to be fed 2% of its body weight in dry matter. In some cases, we can reduce that, but we have to be careful. These are a few examples of breeds that could develop equine metabolic syndrome or will be a little protected. Here you have a Shetland, a Thoroughbred, an Andalusian, and a Mustang. We do have some genetics associated with the development of equine metabolic syndrome, but we have to be quite careful because it's not a simple Mendelian trait. So you have many genes that will be associated with that. So it's not quite clear. What I want really you to remember is that every single horse can be pushed far enough to develop laminitis and to develop equine metabolic syndrome. So it's really about the diet. The genetics will have some effect, but maybe not as much. This is a quick example of the oral sugar test. So the oral sugar test is a test that's going to assess the insulin response to a known amount of dextrose. So this is a horse that was given 0.7 gram of dextrose and was tubed with that, and we measured insulin before and after. So you can see that baseline insulin is around 2. So this is completely normal. But after the challenge, this horse goes as high as 132. So this shows that it is really important for us to do some dynamic testing. The muzzle that is used, we have to train owners. The grazing muzzle is not something that people will know how to use really quickly. So some people will put some duct tape on that. Make sure they do not, because horses need to be able to graze with those. They're going to be able to introduce a piece of grass in that little hole. So if they do not do that, they're going to be frustrated, and ponies will be able to get that thing off, and then they have access to the full pasture. So make sure that owners know how to handle a grazing muzzle. It's not as intuitive, and most of them will need some specific instructions. A second test that can be done to assess for insulin dysregulation is the 2-step insulin test, which is a way to measure how the horse is going to respond to exogenous insulin. So this will be a marker of insulin resistance. You give insulin, and the horse is supposed to drop his blood glucose by 50%. Be careful when you do that test in horses that are not insulin resistant. You could have some clinical hypoglycemia. It's actually quite rare. If you have a pre-test probability that is quite high for the horse to be insulin resistant, you usually have those changes when you have a very minor decrease. Here, I wanted to stress the fact that horses are going to receive steroids in their joint or at risk of developing insulin dysregulation. We have shown that in healthy standardbreds, and the risk is going to increase if you have multiple joints or if you increase the dose. So if you have horses that are at risk or already have equine metabolic syndrome or at risk of insulin dysregulation, it would be a very good idea to test them before you inject them, especially if you're going to inject multiple joints. And be really careful, because you could precipitate an episode of laminitis with an injection of steroid. something that we see in cases with equine metabolic syndrome, they can mobilize quite a bit of fat. So that could happen when we feed them not enough. So if we have a case that would have restrictions in its diet, we see sometimes as low as 1% of body weight. That would be too much restriction. But we also see that in cases that become sick for something else. If a horse with equine metabolic syndrome develops colic, colitis, pneumonia, or something like that, or if the mare is pregnant, they are at risk of mobilizing fat, developing a negative energy balance. And this is something that has to be taken quite seriously because it could have some very serious consequences. A test that I like to do after my horses have been diagnosed with equine metabolic syndrome is the postprandial test. So I think that the oral sugar test is testing the horse. This postprandial test is testing the diet of the animal, the management. So here we have a horse that starts within the normal reference range. Below 20 at the baseline. We give them some feed to it, and we'll look at his insulin going up over time. And we can see that the maximum that horse is reaching is 35, 34. So this is a healthy, good diet. We can simplify that with only taking the blood sample at 120 minutes. This is a picture of a farrier, and I think that since the reason why we care about equine metabolic syndrome is the fact that they're going to develop laminitis, is we really need to have a good partnership with the farrier. I will see that many cases, surprisingly, mainly in the US, we have many complex modeling for the feet and very hard shoeing and things like that. In Australia, it was way simpler and usually much healthier. So you have a good relationship with your farrier. Not every single laminitic horse needs to have some shoes. You need to work with some radiographs. You need to really go slowly on that. This is a pre-purchase examination form, and we have many horses that will be purchased, and maybe endocrine disorders are not taken that seriously. That it will be, the horse is a little fat, but no one cares, and actually it could be a big issue. So it would be very important for a new owner to know what the risk with insulin dysregulation and PPID as well would be when they purchase a horse. So really pay close attention to the body condition. If we have any history of lameness or laminitis, take some radiographs, and endocrine testing could be part of that as well. For medications, we have a few options for equine metabolic syndrome now, although none of them are labeled for this use. So for PPID, Progolide is the only labeled drug, and Progolide is not going to be effective when we treat a horse with equine metabolic syndrome. So we have a few other options, metformin, that will have some very inconsistent results, thyroid supplements that will be more about weight loss, and we have sodium glucose transporter 2 inhibitors that have hit the market pretty hard. Although they're not labeled for the use in horses for this condition, we have already a few reports that show that they are really effective. But diet is the main element. Exercise is another good way of managing that, but exercise alone is not going to be enough, and it's quite hard to exercise some of those horses because they will have laminitis. So we'll have to prioritize the foot, and if the horse is not able to move, we do not exercise those horses. So we need to reach a pretty high heart rate for them to really be exercising. So horses are athletes and are really designed for that. So we need to reach about 150 beats per minute for about 30 minutes daily to really have an effect. And that will not work independently of diet. So this is decision tree that we have published in the Equine Endocrinology group for the management of horses, ponies, and donkeys at risk of hyperinsulinemia associated laminitis. So the first one would be the resting insulin to see if we have a high risk. If we do not have a high insulin at baseline, we cannot say anything, and we recommend doing an oral sugar test. If we have a positive response, here we have a high risk. Once the horse is diagnosed, that's where we go to the postprandial test. And there's no specific marker for that, no specific threshold, but we consider that above 50, above 100 is safe. problematic, and below 50 would be safe. And this is just a good example of how much progress we could make. And this was a horse that was very laminitic, and 12 months later, this is the same horse, the right hind foot, that is so much better, and this horse is now competing and doing very, very well. So it is possible for horses with bad laminitis and equine metabolic syndrome to get better and compete again and be used again for what they were supposed to do. So I would like to thank you for your attention for this. If you have any question, I think this was super, super fast, way faster than what I expected. You have my email address here. So if you have any question, please do not hesitate to contact me. And you also have my LinkedIn account if you want to ask a question that way. So thank you very much. And please do ask questions because that was super, super fast.
It was super fast and brilliant, absolutely fantastic. Thank you so much. For anybody watching this as a YouTube video or on our website, Francois is doing some webinars for us later on this month, and there's just going to be more content for you there available on our Bova Scholars website. So I'll be adding the link onto this as well. So please click on that and take a look at our website where we've got further resources for you. So Francois, thank you so much for being a guinea pig for that one. I think it was super exciting and you got loads of points across really quickly. So thank you very much.
Thank you very much. And thank you for allowing me 40 seconds and not 20 seconds. That would have been a disaster.
I know, I'm so generous. I'm so generous to you. A whole 20 seconds extra. I mean,